The average annual premium for employer-sponsored health insurance for a family is now more than $23,000 per year and climbing. That's just crazy. It's also unsustainable. Many companies have given up hope that anything can be done in healthcare to lower costs and improve value, leaving them feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to employer organizations around the country, and this is Season 2 of A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Our mission is to help employers lower their healthcare and benefits costs, become more competitive and profitable organizations, and put more value back into their employee benefits.
And now, here's your host and 2022 Broker of the Year, Josh Butler.
Hello again, and welcome everybody to another episode of A Snowball's Chance in Healthcare. I'm Josh Butler, president of Butler Benefits and Consulting, and host of A Snowball's Chance in Healthcare, where every week we're discussing topics and strategies and tips and solutions to give you and your company a snowball's chance in healthcare. And it is a pleasure to have Dr. Cristin Dickerson with me today. Dr. Dickerson is the CEO and founder of a company in Houston called Green Imaging. They're one of our best partners when we build High Plains Health Plan and Apex Community Health Plan. And we talk a lot on this program about cost containment solutions. And if you want to pay less for healthcare, you just got to pay less for healthcare. Well, this is it precisely what Green Imaging helps our clients do. Dr. Dickerson, it's a pleasure to see you again, my friend. Welcome to the program.
Thanks so much, Josh. Thrilled to be here.
Yeah, absolutely. How you been doing?
Busy, which is great for this kind of healthcare reform movement. I'm seeing accelerating growth. Really literally every week we have, a new big client coming in the door. So I really think things are changing. And I think that the great thing about that is it's going to help us leverage, all these covered lives and get more providers interested in providing affordable, transparent pricing healthcare.
Absolutely, which is something that we talk a lot about here on A Snowball's Chance in Healthcare. And, we use your business and your sector and your industry very, very frequently in case studies and examples of how we've helped clients over the years save money in healthcare. And where a lot of money goes is in diagnostic imaging expenses. And another topic that we really hit on here is price variance. Talk to us a little bit about Green Imaging and how you kind of got started and where you saw the opportunity to really start to impact what individuals and predominantly self-funded employers, what they were actually paying for non-emergent diagnostic imaging services as compared to what a fair price was.
Sure. Things happen along a long career that kind of start making sense as you get farther along. I started my career in the Texas Medical Center. I was with a big multi-specialty group, Diagnostic Clinic of Houston. I went there because I never wanted to be in the business of healthcare. I just wanted to practice. And lo and behold, here I am way in the business of healthcare now. And what happened there was that we had a new billing manager who came in and found this big box of what we called yellow tickets. And it was all the work that we did at the hospital, nights and weekends. I was away from my babies doing this work, and the hospital wasn't giving us enough demographic information to bill the exams. And it was probably millions of dollars at that point in time in imaging, just in this box of tickets. And so very suddenly I became interested in the business of healthcare. And within a couple of years, I was president of the clinic and running a self-funded healthcare plan, which is kind of how a lot of this got started. And 20 years ago, we did direct contracting. We pulled what we could out of our Blue Cross Blue Shield plan and used local, physicians, the doctors we were working with as a multi-specialty group, who were kind of the surgeons and the other doctors who were peripheral to the clinic. And, just pulled everything out. You tried to use that plan as catastrophic, and we did that very successfully. So I that's in the back of my brain as the rest of this happens. Down the line, Diagnostic Clinic ended up being affiliating with a hospital system. They took over the imaging center, but meanwhile, I had founded a radiology group and went off that direction. And we were staffing the other big prestigious multi-specialty group in Houston, Medical Clinic of Houston, but they didn't want partners. They just wanted radiologists who sat in the back room and read studies, and that's not my way. And so I got the idea. I had 2 or 3 friends called within a couple of weeks asking me why it was going to be so expensive to get an MRI at Methodist Hospital. Why was it going to cost a couple of $1,000s? And what had happened is the chain of imaging centers here in Houston that had been independent and in network was purchased by a hospital system. Right. And suddenly the price tripled. And so I knew that we needed affordable imaging. And here I am reading for all these imaging centers around town that are billing out of network they're at 50% capacity. So why would I open an imaging center when there was all this capacity available? And so I looked into the legality of it and ended up doing lease arrangements with these imaging centers. We would basically buy the scan or lease the time on the table. They would push the scan to us, we would read it, and we would bill globally. So I kind of flipped radiology on its head. Absolutely. And grew quickly throughout Houston, quickly throughout Texas. And I thought, okay, I'm going to be HEB and say this is enough. I'm just going to be in Texas. The problem with health plans is you've got a member who's got a kid in Wyoming. And so as of January 1st, we're in 50 states. And so that's been a big change for us. But that's kind of the path that I've been on.
Well, we're certainly glad that you got on that path, and that it's not your way just to sit in the back room and read images. It's not your way. And now that you're in the business of healthcare, which we're in the business of healthcare too, we're in the business of advising employers that pay for healthcare. And this is an area of self-funded plans that we always delve into. And talk to us a little bit about price variance, though. I mean, what's realistic where you can see, we've told stories where, I think I told you before we started recording today, the worst situation I'd ever seen was a $17,000 CT scan. That was paid. That was not billed. That is what an employer paid for a CT scan. Talk to us a little bit and talk to the audience a little bit about what are some of the most egregious situations you've seen when it comes to just diagnostic imaging.
Yeah, I see those too. We try to get the hospitals to explain some of those because they're way above what their contracted rates are. And they will say, oh, well, we, like you said, we'll bundle, we're bundling up some other charges. This patient had a procedure and some other things, but that's not really legal. Frankly, that's not what they're supposed to be doing. They're supposed to be providing an itemized receipt. So I've seen it just recently. There was a schools consortium as claims data that we did. I think we ran it last week. That was really amazingly expensive. I think the average MRI was over $4,000. The average MRI was over $4,000, and they had a mammogram that was paid out over $25,000. In my network, mammogram cost between $250, maybe at the far end, $500, $525 for a 3D in some communities. Or if I have to negotiate with a rural hospital system. But, that's way too much of a variance.
But Dr. Dickerson, I mean, why are plan sponsors paying these rates? I mean, why on earth would somebody go pay $4,000? Now, this is kind of a rhetorical question, for you and I, but why are these plan sponsors paying these prices if you can get a mammogram for $250? Why on earth would any self-funded plan sponsor pay $25,000?
There are a couple of reasons. Number one, they want to offer the most prestigious. They don't want to exclude the most prestigious, hospitals and entities in their area. That everybody fears not having % in their healthcare plan. If you're from Houston and Texas Children's, although they have by far the most costly prices, so that's part of it. The other part of it is they're not presented the data. They think they see the data, but they're not seeing the data. So I'll give you an example. We have a large client who actually got Aetna on the phone when we presented the claims data and said, hey, you're telling me, I'm looking at my report from you and it says my imaging spend is 6% of the total spend. She's telling me it's 11%. What's going on here? And he said, well, and I said, well, let me ask this. Are the professional fees, you pay the radiologist for the interpretation. Are those included in what you're calling imaging? He said, no, those would be under physician expenses. And I said, number two, the HCPCS codes, the radio tracers, the very expensive radio tracers for PET CT, the radiographic contrast, all the drugs used for nuclear imaging and other cardiac imaging. Are those included in imaging? Nope, they're in pharmacy. And so people really don't get a sense of what they're paying. And if you look at, we have all these people extracting data from the hospital websites. There's something that's also called, well, I call it unbundling because I bundle my prices. But what, and there are actually rules around this. Medicare is very stringent. Medicare and Medicaid, follow those, don't allow unbundling, but a lot of health plans, a lot of TPAs do allow unbundling. And so you're going to have, for a pediatric MRI in a hospital, you're going to have, the facility fee, you're going to have the professional fee, you're going to have the contrast, you're going to have the anesthesiologist, you're going to have the anesthesia assistant, you're going to have, 20, 30 different codes coming together or bills coming together for that's your cost for that exam. And so that's, I think the lack of transparency, the lack of bundling and clarity in pricing is really mislead employers.
Yeah, I couldn't agree more. And we talk a lot about the lack of transparency and how it leads, to just out of control pricing. But there's another element to this conversation that I want to get to and get your thoughts on, because, these are things that are controllable or somewhat controllable. Employers and plan sponsors have more control over this aspect of their spend than they think they do. And that's critical because, let's talk about their fiduciary responsibility. I mean, are we getting to a place, do you feel like employers are getting to a place where they understand their fiduciary responsibility at a level that, hey, I'm about to get in trouble if I average $4,000 per scan versus $500 per scan?
Right. And, it needs to be to the level that they think of the 401k and the fiduciary duty there. And that's not happening in healthcare. They think that they pass that along to the BUCA or the TPA or to, Josh Butler. They really do feel like they pass that along, and legally they do not. And so especially for these high, it's one thing if they're covering most of the cost of care, that duty goes down significantly. But where, with School District of Osceola County in Florida, where the members had a $4,000 deductible, $6,000 maximum out of pocket, 50% coinsurance in between, they weren't doing their fiduciary duty. And that's why the teachers union was able to step in there and talk to the school board and say, you're not doing this. And why we get audited now to make sure they are getting the imaging and the other care that they need. So it's very interesting to see that turned on its head.
Yeah. Well, what are some of the other statistics, like for when we talk a lot to plan sponsors and directly to employers through this program? And some people say, well, Josh, you're only impacting a small number of imaging because most imaging is inpatient. And for example, it's a car wreck and, they're not going to let you leave the emergency room with a head injury to go get an offsite CT scan at a standalone clinic. What would you say, when you're analyzing data like we do, what percentage would you say in most plans? I know that every plan is going to have nuance and differences, but what percentages from a generic perspective do you see are emergent inpatient requirements as to what we would consider like non-emergent imaging?
I think the real emergency care is less than 10%, probably significantly less than 10%.
Wow.
There are strategies to avoid some of those problems. One is having a safe harbor hospital that you got a direct contract with. The employees know this is where I go if I don't want to zero out of pocket. Or, I would also say that, like St. Joseph Hospital here in Houston, a teaching institution downtown, got better ratings than a lot of the Texas Medical Center hospitals. Will give, when my husband needed a surgery that was fairly emergent, we paid $5,000 up front. We got a bill for it later for $40,000 and said, hey, we already paid for this, and they honored that. But, some of it is knowledge. Some of it's also knowing, when you're signing the responsibility page that you're presented in the ER, unless you're, unconscious, that you sign off. I'll pay, reasonable fees up to 150, 200% of Medicare, knowing to sign off on that. There are strategies to take care of that anyway.
Yeah.
And pretty much if you do that, I guarantee you they're not going to do a CT of the head, neck, chest, abdomen, pelvis, lumbar.
Full body scan.
Yeah, they're not going to do that if they know they're only getting 150% of Medicare for that. They're going to get $4,000 a scan.
Yes, they will. They certainly will. And that's what leads to a lot of overutilization and overprescribing in the country. But, green imaging is an embedded solution in the plans that we build here for local employers through High Plains Health Plan. And walk us through the process so everybody kind of understands. It's a really unique process because a lot of times our clients, they say, is this just a scheduling service? And we're like, no, they will assist with scheduling. But, walk us through the process from the time that a member gets, say they need to have an MRI of their knee. Walk the audience real quickly through the process in a self-funded arrangement, but then also tell us that this isn't just a solution that's only applicable for self-funded employers, is it?
It is not. In the self-funded world, if you're a covered life for green imaging, there are a lot of different ways to approach us. Number one, you've got our fax number. You can just have the doctor fax us the order with your contact information, which will be on that order. And we reach out to you and get you scheduled. We're going to be looking for, the best machine for the exam you need. So, for an MRI of the knee, most 99% of orthopedists, if they have an MRI machine in their office, it's going to be a 1.5 Tesla. That's the gold standard. You don't need a 3 Tesla. But if you have endometriosis and there's a 3 Tesla available in your community, that's a better study. It's going to be more sensitive. So, we find the right place for you. So that's why just having a listing of imaging centers like Blue Cross Blue Shield might give you is ridiculous, because you don't know that they do that protocol, that they do prostate MRI, that they do breast MRI. So we're going to, in the background, review that order. Our radiologists actually get involved there if it's anything other than a bread and butter chest x-ray or something very routine. And we're going to protocol that order. We have a database that helps us search based on certain criteria and find the best, lowest cost, best quality exam for you, closest to you as possible. And we'll communicate back and forth. We can communicate on the phone. We can communicate by email. But most of our patients end up secure messaging with us throughout much of the process. I honor that. My mom wants to talk on the phone. I want to email, and my kid wants to text. So, we understand people have preferred communication styles. And also it depends on your work. If you're a school teacher, it's hard to, you can't be on the phone during the day. There are just a lot so we understand communication styles vary, and we honor that. But usually, if you're responding to us back and forth with some screening questions and, your availability, we can get you scheduled in an hour or two. And you've got a voucher that tells you where the exam is going to be performed, what time, what the prep is for the exam. Most of our members do not have an out-of-pocket expense associated with imaging. We believe that that's the best model, is zero out-of-pocket. It's the easiest, simplest, puts the fewest barriers in the way. But if you had a copay, or if you have a qualified high deductible healthcare plan with an HSA and have to pay from the HSA, we will take care of all of that. And then you're going to go present this voucher at your appointment time and get your exam completed. Everything else happens at the other end with your employer, and your employer pays us, and we pay the imaging centers and radiologists who are involved.
It really is. Yeah, it really is a turnkey operation, and we do it multiple times. And one, like I said, I have many examples. I want to use one real quick though, because not too long ago, my parents live about 150 miles from here, and we were talking about rural hospitals before we came on the podcast today. They live in one of these communities with a really small hospital, and they're on a fully insured plan. They have a small company, and we do their benefits, and they're just on a fully insured plan. She's on a high deductible, one of these qualified high deductible plans, and she needed to have an MRI done. Her doctor had ordered her an MRI, and they have a machine there in their local community. But it's hospital based. And she went, and I was advising my mom, and I said, Mom, you better ask for a price estimate. Tell them to run your insurance before you go have that test. Sure enough, they came back and said, Kathy, your out-of-pocket responsibility. This is deductible, and it's going to be like $3,800. And so she calls me and she's like, son, I know you do this stuff. I mean, can you get me a better deal? And we use Green Imaging, and she's in a fully insured plan. She's not even in a self-funded arrangement. But to your point, she was in a high deductible health plan. And if she's responsible for the first $6,000 of her deductible, it's important to her to save money. So we were able to get her up here to Amarillo to an imaging center. And she paid like $385 for her image and her interpretation that went back to her physician. So these are the types of opportunities that we're talking about, not only to save money, but to satisfy their fiduciary responsibility as employers and plan sponsors, right?
Exactly.
Right. Well, Dr. Dickerson, what else can you tell us about, we use this in self-funded arrangements. We use it for, you can use it as a bolt-on arrangement for fully insured plans, but couldn't even an individual, you don't charge any fees up front, or any monthly fees or anything like that, do you, when you said when you're covered under Green Imaging, that doesn't imply that someone has to pay a membership fee to use your services, correct?
They do not. We're fee for service. And in fact, I didn't mention that we read over half the exams performed in our network. So our radiologists, a significant portion of our income is based on reading the studies, because we're 100% radiologist owned and operated. We are a radiology group at our core, and that's our primary means of income. We have provide a lot of other services for employer health plans, including savings reports, claims data analyses, lots of other things. So we do have a markup on, when we rebundle everything, there is a percent that goes for our administrative work, but that's all in. It's all in that bundled fee. And I think an important thing to remember, like for your mom's situation though, is how we have to empower individuals. So even if you don't have Green Imaging in your health plan, you are empowered when you go to that rural hospital. And so these are the important words to know. And that is, I have a right as an American to not have you send my personal health information to my insurance company, for me to negotiate a rate with you, a self-pay rate with you, and me or somebody else pay, on my behalf for this exam. And hospitals will say, no, you have to use your insurance. It's part of our contract. And that is wrong.
That is wrong.
Omnibus law. And you can say, that's actually a HIPAA violation. Would you like me to report you? Because it's even for that person to be looking at your chart without permission. If you just go into to a hospital and say, I want to not use my insurance, I want it self-pay pricing, they frequently give two different rates, one if you're insured and one if you're not. So the only things that you should have to give them are your name, the exam, and I think it's your date of birth is the third element. Now, that doesn't mean that they're not using the scrubbers in the background looking to see if you have insurance. And I always tell people to use my name and my date of birth because I don't have insurance. I'm in a health share. And so I'm perfect to get pricing because I'm not going to show up with any insurance in their database. So.
And we did an episode on that. We covered the HIPAA high-tech law because, it's still, and we were talking about this before we came on today too, about it's surprising that some providers, not all are this way, but some facilities, and not all facilities, but some still do that. And they say, hey, this is insurance fraud. If you have insurance, we have to file a claim. And that is not correct. And so thank you for reiterating that point, because that is another thing when we've seen this mass exodus into high deductible health plans out there in the market. Sometimes the price differential is the literal difference between a person getting care that they need and not getting or being able to afford the care they need. So cash is still king in a lot of areas in healthcare, but just because you have insurance doesn't mean that you got to use it. Dr. Dickerson, we got a couple more minutes. I'm going to give you the last word here.
Okay, well, I think one other thing that people need to be aware of is the hospital charity policies. I think we don't hold these not-for-profit hospitals to their required charity requirements. They have them. They're very generous income limits. And so make sure that you're not covered by that. I hear people all the time say, well, I just can't afford that. I said, please, 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 then go talk to your local hospital and find out what they don't ask them for pricing. Get their charity policy and see if you don't fall in there. So that's my last pearl, my last hack.
Absolutely. Well, ladies and gentlemen, their website this is Dr. Dickerson. She's the founder of Green Imaging, and their website is greenimaging.net. And you don't have to be a member. You don't have to pay dues or fees or anything like that. But if you're searching for affordable, high quality diagnostic imaging, things like mammograms and CT scans and MRIs and sonograms and those types of things, they're very, very common. They're very prevalent in this day and age. Diagnostic imaging is. And this is a very key way if you're a self-funded employer, an HR manager, or a CFO out there, listen up. I know that one of her best studies a couple of years ago was she saved the school district over $1 million in 1 year just on imaging services. I'm sure you probably got a bigger case study than that now, Dr. Dickerson.
Yeah, but we saved him 3.7 million.
Oh my God, 3.7. I've got to update my slide deck. But just think about that for a second, folks. $3.7 million saved on a school district, public taxpayer dollars, just in one category. Okay, it's amazing. Thank you guys so much for tuning in this week, and thank you, Dr. Dickerson. You've been a great partner to Butler Benefits and our team. And as like every other week, join us next time when we're sharing tips and strategies and solutions like green imaging to give you and your organization a snowball's chance in healthcare. God bless. Have a great weekend.